Perfect. So first of all, thank you for having me. My name is Daniel Zazueta Borboa. I'm PhD student at the Netherlands Interdisciplinary Demographic Institute and the University of Groningen. My today's presentation is about rural-urban differences in life expectancy at age 50 using data from the Mexican Health and Aging Study. This work is in collaboration with Dr. Rebecca Wong and Anil Midha. So the motivation in this paper, sorry, is not changing the slide. Well, anyways, the motivation in
So you can't change them?
I mean, it seems like it's, I will stop sharing and sharing again.
Okay.
Let's see if this works now. Can you see this?
Yeah.
It's not moving at all.
Hmm.
Sorry.
Ellie, are you there? Do you want to download and run his slides out of the
Yeah, I mean, it seems like, wait. Sorry. I promise I will catch up in the presentation.
That's fine. Just calm down. Just relax.
Yeah. Okay. Let's try it over again. Yeah, perfect. So the motivation for this paper in specific is demographic aging in Mexico, as in many other Latin American countries. And we often tend to analyze these countries based on the change in the population structure. That's one of the main reasons that we decide to put so much relevance in this topic, and also in the health-related factors driving these changes in the population structure. But today I want to focus on one specific component, that it's mortality. Okay. And that's because, for example, this graph shows how life expectancy has been evolving in Mexico, life expectancy at age 50, in comparison with other Latin American countries, in fact, with the 10 highest life expectancy in each year. And what we observe is that for both males and females in Mexico, during the 90s, we observe an increase in life expectancy, but since then we observe some sort of stagnation and even a decrease in for life expectancy in Mexico, while for the other Latin American countries, life expectancy has been continue increasing, no? And if we get a closer look at what happens at the subnational level, what we get is a strong gradient between northern, central, and south regions in Mexico, where we observe gaps for even almost 3 years, just by different place of birth. And even though this is quite relevant and we know about these strong gradients across Mexican territory, the urban differences in mortality in Mexico is not yet well addressed. Partially because there are not official statistics, well, not official estimates. We have statistics, but there are not official estimates from the government. But from previous studies, we know that, for example, there is a higher all-cause mortality in urban areas in Mexico. Urban areas are defined by those population with more than 100,000 inhabitants. And this is something that persists across all age groups. And there are also some studies that have looked at the differences in lifetime occupation and mortality across urban and rural areas. What they found is a strong gradient for agriculture, mostly because men in rural areas tend to dedicate their prime lifetime occupation in agriculture industry. And this is an important factor of shaping this relationship between occupation and mortality, no? But in terms of life expectancy, there are not really so many estimates around it, but there is one from Luis Rosero Bixby that, although was not the main goal of the paper that I'm citing here, he shows the results for life expectancy at age 60 between urban areas using Mexican Health and Aging Study from wave 2001-2012. And what he found is that in urban areas, there is a lower life expectancy at age 60, on average 2 years lower for males and 1.8 years lower for females. And for that reason, what we decide to study is to estimate life expectancy by age 50 by locality size, meaning 4 different locality sizes that are the official ones from the National Institute of Statistics. But then we focus on the difference between urban and rural areas, and we assess the age-specific contribution to this gap between urban and rural areas in life expectancy at age 50. So the data, as I already mentioned, is from the Mexican Health and Aging study. We look at the wave 1 up to the wave 5, that is in 2018. And the criteria for inclusion or the participant in the study is that they were 50 years or more at the baseline, so in 2001. And then I follow the same approach as Irán Beltrán Sanchez in another paper that he published for occupation and mortality, and how to track the individuals across waves. And we use the similar criteria of excluding individuals that were missing for 2 consecutive waves. And to add some robustness or to compare our estimates in life expectancy of MHAS, we decide to compare with the estimates from the National Population Council in Mexico. Those are the official estimates of life expectancy. So in order to assess how bigger is the difference between the estimates from the Mexican Health and Aging study and the ones that are reported from the Mexican government. The variables that we include, it's very simple. It's just sex, males and females. And we use 4 categories for locality size, and I put these silly names just to label them. Urban areas are those that has more than 100,000 inhabitants. Rural, those that has 2,500 inhabitants. And then I define one that is less urban and a little bit less rural. And these are more or less the sample sizes. We have almost like 11,000 individuals with almost 4,000 deaths. Most of the individuals and deaths occur in urban and rural areas. It's important to remember that the sampling design from the Mexican Health and Aging study, it's representative for urban and rural areas. And regarding the methods, we use a very simple approach. So it's a survival model. We use a comparative regression model to estimate the mortality rates by age groups, by age. So we obtain these parameters from the compare models to model these age-specific mortality rates. And later we use those age-specific mortality rates to build life tables to obtain life expectancy at age 50. And we did that by sex and by urban and rural area status. So these 4 different locality sizes. And later, to assess this gap between urban and rural areas, we perform a decomposition methods called stepwise replacement method. And we implement that using the R package demodecomp. So moving on to the results, the first thing to look is the overall life expectancy estimates for males and females, and its comparison with the ones from the National Population Council. So what we observe more in general is that the estimates are more or less falling into what it was expected or estimated by the government. Of course, we have a wider confidence intervals, but at the same time, we are looking at a cohort, no? We are not looking at period life expectancy, so that's also important to take into account for the results. But in general, the results are quite similar. So we get 28.4 years for males and almost 31 years for females. But if we want to have a deeper look on why the difference between the life expectancy from MHAS and the average life expectancy from these 3 years using the National Population Council, we use the composition method to assess these differences, right? So what you observe in the panel is like the age-specific contribution. So if you sum all these little bars, what you get is the final number that is between CONAPO minus MHAS. So for females, it's minus 0.61 years, so differences. And most of these differences are due to mortality difference between ages 70 and 84. While for males, the difference is almost for half of a year, a little bit higher in MHAS. But then the difference is coming more from what it's observed in mortality between ages 50 and 59, so at younger ages, no? And moving on to the results by locality size, what we get first is that there are no statistical differences in these estimates of life expectancy. Although if we observe the mean value or the mean estimate, what we get are some stronger differences, especially for males, and we get almost 3 years differences in life expectancy between urban and rural areas. For females, it's a little bit less, but I will show the numbers later. And first, we decide to look at where are the difference in terms of the mortality rates, no? So this graph shows the rate ratio. Basically, is how much times is higher the mortality in urban areas. So all positive values indicates how many times is the mortality in urban areas higher in each age specific group. So for males, what we observe is that almost virtually before age 90, the differences are much higher in urban areas. So the mortality there is a little bit more higher. But if we look at the decomposition results, like to assess exactly which age groups are driving these differences, what we get is that if you look at the right panels, the ones that says urban versus rural, and for females, we almost have 1 year differences in life expectancy. And then most of those differences are concentrated what happened between ages 65 and 84, where for males, the differences between urban and rural areas, it's almost 3 years. But there the differences is more or less for mortality below age 70. So these are very preliminary results, but in summary, what we are obtaining is that urban areas experiences lower life expectancy at age 50 compared to all the other 3 different areas, where the largest gap is observed with those in rural areas, no, the most rural. And the difference by sex, what we get is that for males, these differences are more pronunciated. And in terms of the age-specific groups that contribute to explain these differences, we also get that for males, most of these differences are coming for mortality below age 70, while for females, the differences are occurring between ages 65 or 85. So the preliminary conclusions that we have now is that these differences are much larger for males than maybe occupation and agriculture, or the differences in lifetime occupation might be one of the factors driving these differences. And the other one that is also important is that the MCAS is a reliable source for tracking life expectancy and mortality in Mexico, and has one very important feature that other statistics in Mexico doesn't have. That is that we don't suffer for the numerator-denominator bias, no? Because in Mexico, if we want to look at the differences in mortality using administrative data, we have to use 2 different sources for the numerator and for the denominator. That can cause a little bit of, or not getting us a very fine estimate, while with MHAS, everything is coming from the same source. So thank you for your attention, and I would like to thank the team from the Mexican Health and Hygiene Study.